Thank you very much. I just was hoping for your reaction to the latest overdose numbers, 147 people again in the last month. What are you promising to do differently if you were to win again? And why hadn't you done it in the last 3.5 years that you've been in power?
Well, thank you very much for the question, and I am as concerned as other British Columbians about the increase in opioid deaths as a result of the pandemic, quite frankly. We've been asking people to separate and distance from themselves, so increasingly people are finding themselves without a friend, without a loved one nearby, and that's led to a significant increase in overdose deaths. But I want to just go back to what we have done over the past 3 years to address this scourge, this public health emergency that has been with us now coming on to close to a decade. We put in place a Minister of Mental Health and Addictions, the first in Canada. We've started to put in place recovery beds and programs and regimes to make sure that we were bringing information to people as they needed it so that we could help them get through these most challenging of circumstances. These are situations that involve our mothers, our fathers, our brothers, our sisters. Regular people are affected by the opioid crisis through no fault of their own. It's important that we all work together and understand with compassion the challenges people face in this most challenging of times. A global pandemic is not the best of times to have an addiction crisis, and the challenges for our public health care system have been profound as well. But we've taken steps, and this summer we brought forward a bill, the Minister, Judy Darcy, brought forward a bill to protect young people who were admitted to hospital after an overdose. And the bill would have allowed those children to stay under medical supervision for a week, hoping to find clarity where we could find a place where they would get to a point where treatment and recovery would be possible. And the Green Party wouldn't support that bill. We took steps this summer to address the challenges that families face when it comes to the epidemic, the scourge of opioids, and we were rebuffed by our colleagues in our so-called stable administration. We've also reached out to the federal government, joining with the police chiefs of Canada, saying that we need to decriminalize simple possession of narcotics. We don't want to make criminals, we want to help patients. That's what this is all about, and we're going to continue working on that. We're going to continue to have a Minister of Mental Health and Addictions in the next government, and it will be that minister's responsibility to work every single day to make lives better for those who are suffering from mental health or addictions.
Susanna, do you have a follow-up?
Yeah, this is a bit on a different stream, but I know it's campaign time at this point, but doctors across the country, of course, are sounding the alarm about the rising COVID numbers. Would your government shut down parts or entire parts of the province if hospitalizations and infections increase?
I have every confidence in Dr. Henry and her public health team. She has been providing good guidance, not just to government, but to the people of British Columbia since the beginning of this pandemic. We have in place a minister behind, Carol James, as we campaign, the Deputy Premier and Finance Minister who is overseeing the administration of government. Government continues, services are being provided. We are just out asking for people's support, asking British Columbians what they want, who they want to lead them, and where we are going to go. But in terms of how we will continue to manage the pandemic, that is in the hands of public health officials, and most importantly, it's in the hands of British Columbians. We have had success to this point in time because everyone has been pulling together. People in communities understand that we need to physical distance. We see today our collection of MLAs at a good distance apart. If we can't stay a distance away, by all means wear a mask. As I look out at the media assembled here today, again, a small number of people in an enclosed space with appropriate distances and masks where necessary. Wash your hands. Do all of the things that Dr. Henry's been telling us. Keep those groups small. Keep your bubble familiar. And if we keep following those directions, we'll get through this.
Our next question today is from Rob Shaw.
Well, hi, Premier. I want to follow up on that statement you just made that the Greens would not support your youth overdose recovery bill. The coroner, the Union of BC Indian Chiefs, the Children and Youth Representative, and the BC Civil Liberties Association all came out in opposition to that bill. And you, up until now, have never really spoken about how important it is since the election started. Why are you blaming this on the Greens? And if it was such an important bill, why are you just starting to talk about it now?
Well, thank you for the question, Rob. I believe this is an important bill because I've talked to parents who've lost children, and they wanted action. They wanted government to do something so there was at least a legacy for the loss of a loved one in their family. We brought forward the bill in good faith. There was differences of opinion. That happens, as you know, Rob, with every piece of legislation brought forward. We had vigorous discussions. Minister Darcy went over every particular portion of the bill that was a concern to the Greens, and they refused to support it. I made that known at the time. I'm raising it today because I was asked a question about what we would do to address the increase in opioid deaths. I've mentioned a number of issues. That youth mental health focus will be back in the next Parliament, and I'm hopeful it will have the support of the legislature.
Do you have a follow-up, Rob?
Yes, thanks. Andrew Wilkinson is in Victoria today, and he's expected to tour some of the businesses that are affected by the hotels purchased to house the homeless. Can I get your response to what I'm sure will be his criticisms that your government hasn't done enough on the law and order issues of protecting people and businesses who have been impacted by the crime near the government's homeless hotel purchases?
Yeah, well, thanks for that. And I'm glad that Minister Wilkinson is visiting Victoria, my community, to talk to people there. And I'm confident that he will have criticisms because that has been his role over the past number of years. I want to focus on how we find solutions. And that means working with local government, whether it be the Victoria City Council, which is having significant challenges with an increased number of encampments in and around Victoria. We want to work with them, as we do with the mayors of Vancouver, Kelowna, Nanaimo, and other communities that are affected by an increase in homelessness as a result of dislocation in our economy. But these are not short-term fixes, and I think British Columbians understand that wherever they may live. We have serious issues ahead of us. It's not a 12-month proposition, it's a 4-year proposition, and that's why I've called an election, so we can settle the politics, put them behind us. Is criticism warranted? Absolutely. That's what our civil discussion is all about. But let's make it constructive criticism towards solutions rather than just criticism for criticism's sake.
Our next question is from Binder Sajan.
To know your reaction to Dr. Bonnie Henry reporting that she has been the subject to abuse and even death threats given her position as a woman who is working on this pandemic. And also I wanted to know, have you ever been in a situation where you've seen a woman leader disrespected, and what did you do?
Well, I am horrified to hear that Dr. Henry has been subjected to threats of intimidation and other threats to her person. I know her to be one of the most kind, compassionate people I've ever come across, totally focused on making sure that British Columbians are safe. And it is beyond tragic that individuals in the community would use their anonymity of the internet or other mechanisms to try and intimidate someone who gets up every day to try and make life better for the people in her community. Having said that, intimidation of elected representatives and public figures, male and female, is regrettably part and parcel of the anonymous nature of the internet. I regret that very much. I have certainly criticisms made of me that are fairly harsh. My family, people coming to my house to get their point of view across. That happened to the former Premier, a woman, as well. It's unacceptable, regardless of gender, but it's particularly galling when someone, a public servant of the stature and caliber of Dr. Bonnie Henry, has individuals who are taking advantage of their anonymity to make unacceptable, absolutely unacceptable and potentially illegal threats to her person. I know law enforcement will be working on that, and they'll have any support I can give them.
Do you have a follow-up, Binder?
I do. You're in Surrey today. I'm not sure how far your tour has gone in Surrey, but the last time I was there, I was struck by the number of signs that say to save the RCMP. If you are elected again, is this an issue that you would be willing to revisit?
Well, it's an issue that's the responsibility of the local mayor and council. Delivering public safety services are the responsibility of municipalities supported by the provincial government. The Solicitor General, Mike Farnworth, has been working very closely with the broader community, which includes not just those at the council level who've made the decision to move towards a municipal force. That discussion is still very much underway. We're working through these issues. We wanted to make sure that the public had every opportunity to have their say, but ultimately the decision rests with the mayor and council, and I suggest, and I have suggested repeatedly, citizens and my colleagues here know this full well. They hear it in their constituency offices and around the community all the time. This is a divisive issue. Mayor McCallum opened up the hornet's nest, and Mayor McCallum is responsible for it.
Our next question today is from Ian Bailey. Go ahead, Ian. Oh, we'll move along. Next question is from Richard Zisman.
I'm just wondering about, you're in Surrey today, and one of the promises you made in the last campaign was to get rid of the portables in Surrey. What do you say to those families who still send their kids to portables every single day, and why did you break that promise to them?
Well, thank you for the question. I made that commitment with my colleagues here before the last election, well before the last election, and there was an expectation that the former government would be building schools to meet the demand. In the last 3 years of the Liberal mandate, before we formed government, there was only one school built in Surrey. Since we formed government, $400 million has gone into new schools, seismic upgrades, and additions to existing schools that will service almost 9,000 students. We've done a great deal and we have more work to do. I would characterize this as a failure by the previous government to put us in a position where we could meet the objectives of meeting the needs of the kids in our community. Surrey is the fastest growing community in the province, has been for a long, long time. The former government, again, the one that Mr. Wilkinson professes to have done such a good job, they sold the silverware when it came to a hospital, and they built one school in 3 years. So I'll put my team's record up against the record of the former government any day of the week.
Do you have a follow-up, Richard?
I get that, but people will just hear this as, you know, it's a broken promise, that you're blaming someone else for something that you could not deliver on. They've also now seen that you broke the promise on CASA. There's confusion around what happened with the candidate in Stikeen. Do you think voters are going to have a hard time trusting you this time around after you built a lot of trust with British Columbians? Have you broken that trust?
Not at all. First of all, with respect to the CASA agreement, I gave you just a few examples in recent memory of an inability for the Green Party to work effectively for the interests of all British Columbians. Secondly, none of us contemplated a global pandemic 3.5 years ago. I believe the people of British Columbia want me to focus on today and tomorrow, not yesterday, and that's what I'll continue to do. When it comes to delivering schools here in Surrey, again, the record is pretty impressive. $400 million invested, 9,000 students affected as a result of that. Have we done a lot? Yes, we have. Is there more to do? Certainly. And that's why I'm asking for support here in Surrey so we can finish the job.
Next question today is from Rob Buffum.
Oh, hi, good morning. I guess my first question is, I just spoke with Sonia First now and asked her what she thought the defining issue of this election would be, and she said trust is what she thought it would be. I'm curious, in your view, what is the singular defining issue of this campaign?
Well, for me, it's, and I know all British Columbians feel the same way, is the government of British Columbia totally focused on the well-being of citizens by getting us through a global pandemic? And are we focusing on making sure that people, businesses, and communities have the support they need so that we can continue to provide services at this most critical of times? That's the defining issue of this campaign. That's why I'm asking for people's support. I don't want to spend 12 more months involved in politics. I want to spend the next 12 months focused on the people of BC, and that's what I'm going to do.
Do you have a follow-up, Rob?
I do, thanks. Yeah, I'm wondering, you mentioned earlier when you were speaking with Rob about, you mentioned Victoria City Council and working with them regarding the homeless. That council has passed the bylaw, I think, that they'll allow people to camp 24/7 outdoors until a state of emergency is ended. You've indicated part of the reason for all this election is that you expect us to be in this pandemic well into, a year from now. If your government is elected, what would you do to work with the city? And would you, continue to allow them to have people camping 24/7 for, a year and beyond?
Well, we invested significant amount of resources, not just in Victoria and Vancouver, but across BC, to build housing, not just, again, not-for-profit or social housing or for the hard to house, but the whole continuum of housing. We have had a significant challenge when we formed government in 2017. This was speculation heaven for those who had free capital to invest in real estate, driving up costs for regular people, and then leaving those homes vacant and seeing our vacancy rates going high because we couldn't find places for people to live. We brought in an empty housing tax, a vacancy and speculation tax that's seen a whole host of condos in Vancouver, for example, now turned into rental housing. That's taken pressure off lower end housing so that more people are finding a place to live. We're allowing universities to build social housing now, or pardon me, residential housing. That again takes pressure off the rental market in our cities like Victoria, Burnaby, Surrey, and other places where we have post-secondary institutions. We've taken a number of steps on the housing front to bring down costs for people and to create more supply. We've been working with the development community to make that happen. BC Housing has been absolutely spectacular in bringing on modular housing so that we can get people in houses, get them out of the bad weather. And now we've seen a spike in encampments, combining the challenges of the pandemic with an inability to use traditional shelters because we need to physically distance. These are all big, big issues, and they won't be fixed with the waving of a wand. They'll be fixed by hard work and commitment, and that's what I'm committing to do for the people of BC. Keep working at it.
Next question is from Marc Belanger. Mark, go ahead. All right, then, we are going to move to Andrew McLeod.
During the early months, there was a spotlight on some of the issues in long-term care. If re-elected, what would you do in long-term care?
Well, Andrew, I apologize. I'm going to have to take every third word and try and construct an answer. Could you try that one more time? You were breaking up throughout that.
Here, I'll try again. The question was care and what do you expect to improve care?
If the question was what steps are we going to take to improve long-term care in British Columbia, again, another good example of contrast between what the former government did and what the current government has been doing. The former government, you'll remember, ripped up contracts for healthcare workers, one of the largest firings of women in North American history, and we saw a rapid decline in the number of people working in our long-term care facilities. Just before the last election, Isabel McKenzie, the seniors advocate, the seniors advocate for the Ministry of Health, identified 83% of the long-term care facilities in British Columbia did not have sufficient staff to meet the needs of the residents of those homes. When COVID-19 hit, we discovered, as we all knew, but the public discovered, that because of former Liberal policies, we did not have enough people and we did not pay a sufficient wage for one site to be sufficient to keep a family going. So many of our long-term care staff were working in 2 and sometimes 3 facilities, which led to an increase in transmission of COVID-19, directly linked back to bad policy choices when it comes to delivering services for seniors. So Minister Dix has taken extraordinary steps to ensure that only 1 facility per employee, and also committed to hiring 7,000 new employees to meet the demand going forward. We are totally focused like a laser on making sure that our seniors and our vulnerable populations have the supports that they need, but that involves people. Our whole healthcare system is predicated on having people providing services for those who need them. The former government felt that it was easier to cut corners, and they diminished the value of people that worked from cleaning to providing food or for becoming care aides in the long-term care structure. They diminished and disrespected those employees. They fired many of them. They cut their wages by 15% in some cases, and we have completely turned that around, and we're going to continue working on that. People deliver services for people.
Andrew, do you have a follow-up?
Sure. A few months ago, there was talk about looking at the ownership model, especially as we saw what happened in some of the care homes.
Yeah.
I'm wondering if that is the table here, or would it be re-elected?
Yeah, Adrian has been working on that from the beginning. We continue to try and find the best model to deliver services for people. That's what the public expects of us. This is not about what's best in terms of for-profit or not-for-profit model. We want to make sure that we're delivering those services, and that means a government that's focused on getting the best model for what community you're operating in. What works in Saanich may not work in Sicamous. What works in Vanderhoof may not work in Vancouver. So we work with the health authorities, 5 of them across the province and 6 with the Indigenous Health Authority, to make sure that central government is providing the resources and the policy framework so they can do what they're supposed to do, and that's help people.
We have time for one more today, and that will be from Tom Zatarik.
Good morning. Hello.
Hi. Go ahead, Tom.
Hi, Premier. What's the current frame for the construction of the hospital in Cloverdale, and has the business plan been all finalized?
The business plan will be finalized later this fall. The money is in the budget. The land has been assembled. We're pretty excited about it. Fraser Health has been working very, very hard to finalize the details. That'll be known later into the fall, but this is a commitment that is carved in stone. Their dollars are on the table. Now it's about making sure that we manage the development appropriately. We don't want to rush this. We want to make sure we get it right, but the hospital's being built, and I think a large reason why Mike's standing with me today is how proud he is of the work we've been able to do to demonstrate to the people of Surrey that this government has been focused on their needs from day one.
Tom, do you have a follow-up?
Yes. On the policing transition, your local MLAs in Surrey have taken a lot of flack from opponents of this process. Are you concerned about their election prospects as a result of a mounted campaign against them?
Well, I'm not. I'm concerned about the issue. I'm not concerned about the competence of my team. I know that politics isn't about pats on the back all the time. Sometimes you have to take a bit of a poke in the face. They know that. We've got a pretty seasoned group here, but I'm not skating away from the issue. These are divisive issues that were brought to us by the election of a new council and a new mayor in Surrey. And we're working with the community as best as we can to make sure they know all of the information, to make sure they understand what the costs of a transition will be, what the impacts will be on the delivery of services. That's our responsibility. That's the responsibility of my colleagues, trying to find a way forward that meets the interests of all of the people in Surrey. And I know I'm committed to that, and so is my team.